today marks another major milestone in the history of Apollo, history of healthcare of India in bringing the easy test for detecting breast cancers with a simple blood test. Please remember this. It's a simple blood test. You can detect breast cancer at the earliest stage. And if you detect it early, the science lab like Dr. Bandari will find it very easy to remove it when the patient is absolutely. So I think I must compliment Datar Genetics who have done this. It is not, we are not first in India. He has already taken it and got an FDA approval. He has about 15 countries across the world. Probably he will explain a little more on that. 15 countries, they are already doing it in UK, US and other European countries. But in India, we have an exclusive arrangement with Datar. We will do for all our patients. Many of our centers, we have already got plenty of centers. We will open more centers so that we can make this early diagnosis. You all know that we are the first in the world to have started a health checkup program called the Mass Health Checkup.
First time in our country, and the Datar group has actually taken it to other countries. You know, it's already in the UK and will soon be in the US. So to partner and to do not only in India, but we're looking forward to be able to doing it together in other countries, because now it's a proven success. It's FDA approved, it's got the CE mark approval, and for us it is something which we need to do for ourselves. We need to propagate the fact that when disease is detected early, especially cancer and breast cancer, it's totally curable. And so with that in mind, I think we're doing, it's definitely the right step in the right direction.
My name is Dr. Ratna Devi. I'm a Senior Consultant Radiation Oncology, Apollo Cancer Center, Chennai. Cancer breast, the abundance of cancer breast, we had a big session today to know the statistics and the incidence of increasing cancer breast in the country. About 20 to 25% of, it amounts to about 20 to 25% of all the cancers affecting the female population. If detected this cancer early, at an early stage, we not only achieve a cure by more than 90 to 95%, we can save the organ of the patient as well. That is, breast conservation is a possibility when detected early. That helps a lot in the psychology of the patient. Screening is a must because of the increased incidence and the prevalence. What is screening? Searching of a positive result in a totally asymptomatic person is called a screening. There are a group of people, or I can call women, who come under the high risk group, like who have a family history, positive family history of breast cancer, who have attained early menarche, late menopause, and advancing age of a woman itself is a risk factor. And if you see, this kind of breast cancer is affecting more on the urban population than the rural area. It is because the urbanization itself is a risk factor. Obesity, lack of exercise, and poor diet, all these contribute to this cancer. There is also other contributing factors are there, like hormone replacement therapy. There are certain individuals who will need a hormone replacement therapy, and automatically these people come under this high risk group. We need a screening test which is highly sensitive, highly specific, and easy to check. And here is a boon, I would say, which is a easy check 360. With by means of a blood test, we are able to detect this cancer early. Thereby, early detection becomes a possibility, and thereby cure is also a possibility. Thank you.
My name is Dr. Manjula Rao. I'm a consultant breast cancer specialist oncoplastic surgeon practicing at Apollo Proton Cancer Center in Chennai. So today we are here this afternoon launching the Easy Check Breast blood test, which is a test to detect breast cancer cells in the body. This is a supplement to existing screening modalities such as mammogram and a breast MRI. In India, as we know, breast cancer, of course, is the commonest cancer in the world, and in India, more than 60% of the cancers are detected either in the locally advanced or advanced stages. As a result, this is in contrast to the West, wherein breast cancer is detected in the very early stages because of pre-existing screening programs. So only less than 10% of the cancers in the West are actually detected in the advanced stages. So this is the need of the hour, and I consider this occasion to be a very momentous one. The launch of a screening test which is as simple as a blood test. Very relevant in our country because of the convenience. It's just a simple skin prick, just like you would get yourself tested for your sugars or your cholesterol. It is easily accessible, and in certain parts of the country where it's difficult to transport technology such as a mammo machine or an MRI, it's easy to and convenient to get a simple blood test done. So this is a good opportunity for those patients where screening modalities may not be accessible. So I think this is a very positive. It's a very positive progress that has occurred, and we're looking forward for screening to take up in a big way in the country. Thank you.